Hello everyone, welcome back to the channel. My name is Dr. Rosa, you can call me Dr. Rose. And today we're going to be giving you another update on COVID-19 and the coronavirus pandemic. So in between taking care of patients in my residency and staying up to date with all the new updates that have been coming out, I've had my hands a little bit full. And this video, recorded on March 15th, 2020, is to bring you updated information on how to keep yourself safe from COVID-19. On our last video, we talked that the coronavirus was a pandemic. Well, in March 11th, 2020, the WHO officially declared the novel coronavirus as a pandemic as it has spread to more than 100 countries worldwide. Afterwards, in the US, President Trump declared a state of emergency due to COVID-19. Also, I want to say that I joined the voice of so many doctors and healthcare providers to stay informed and up to date with the updates, but don't panic. I know the media is in part to blame for this mass panic because they've been covering the progression non-stop. I'm not going to talk about the deaths or numbers in ICU patients because their bad outcomes must be analyzed case by case. But what I am going to cover is how it spreads and how you can prevent it. Which brings me to infection risk. We know that this virus, despite having a low mortality rate compared to influenza, it can spread much easier and faster than the flu. And so, with more than 2,000 cases confirmed, we need to enact preventive measures to prevent the spread to the most vulnerable and to not overload our healthcare system. It's important that we follow these measures to avoid the spread of the virus to those who can't protect themselves. These are the elderly, especially those above 60 years of age, people with underlying heart or lung conditions, as well as the immunocompromised. This is what we call herd immunity. In regards to the amount of cases, like many other physicians, I too think that the number of cases is highly inaccurate, mainly because the lack of the necessary amount of testing kits. It's expected that the amount of cases will rise as the kits become more available and more people get tested. But again, keep yourself informed, don't panic. However, herd immunity measures are very important at this time because we're trying to flatten the curve. This simply means that through preventive measures, we slow down how the virus spreads and decrease the amount of sick people, ensuring that they're able to provide the same level of care and resources to everyone. If we don't, we have the risk of overloading our system, leading to the inability to have the resources to care for and thus increasing the chances of more people dying from COVID-19 or other sort of issues. This is what's happening in Italy, where hospitals are being overrun by patients requiring respiratory support and not having enough resources in ICU beds. There's another area in which we've been able to acquire much more information. On my previous video, I mentioned that packages coming from China were safe. Well, recent research has shown that the virus is able to survive up to 24 hours on cardboard surfaces and up to 72 hours on plastic and metal surfaces. And so it's important that you clean your surfaces frequently, especially public ones. So what can you do to protect yourself and the most vulnerable? I give the same advice to my family. If you're taking care of someone, make sure they have enough supply of their medications, especially for heart problems, blood pressure, and diabetes. Make sure they have enough household supplies and food that would last them a couple of weeks at home. If they're either at a nursing home or on their house, avoid visiting to decrease the possibility of you exposing them to the virus. Instead, call them to make sure they're okay. Now, to be able to prevent infection, often wash your hands for at least 20 seconds with soap and water, or use a hand sanitizer if no soap and water is available. Avoid large crowds and gatherings. Work from home if your job allows you to do so. Avoid close contact with sick people. Cover your mouth and nose with a tissue or the inside of your elbow if you cough or sneeze. Frequently clean surfaces with common household cleaning products. Pay attention and stay informed with your local news source. If your area is experiencing an outbreak, stay home as much as possible. If you or a loved one is sick, please seek medical attention. If you're experiencing mild symptoms, please call your physician in advance. If you're experiencing severe symptoms, please call 911. Only wear a mask if you're sick or if you're taking care of someone who is sick. Stay home if you're sick. Avoid sharing personal items. Stay in a separate room and use a separate restroom if possible if you live with others. So this is all for today. If you have any questions or comments, please leave them in the comment section down below. If you like this video, please like and subscribe. It means a lot. I will certainly keep you updated as much as I can with all the updates regarding the coronavirus pandemic. And until the next time, I wish you a happy and healthy life.